Welcome to Nursing with Professor B. My name is Brigitte. I have a master's degree in nursing education. I'm also a family nurse practitioner. In today's video, we will be going over NCLEX style review questions as well as rationales. Before we get started, make sure you hit the like button, make sure you subscribe, and make sure you turn on that notification bell. Let's go. All right, let's get started with some NCLEX practice. Question number 1. What is an appropriate nursing intervention for a client with borderline personality disorder? So what is the key word in the question stem? It says nursing intervention and then borderline. Borderline, I would say, is the biggest key word. What do we know about borderline? The thing you need to know about borderline that is most frequently tested on is that they engage in self-injurious behavior. They cut, they self-harm, etc. It's very frequently tested on. Keeping that in mind, let's go through the answer choices. A, observe for signs of depression and or suicidal thinking. B, encourage the client to lead unit group sessions. C, encourage alone time for reflection. And D, allow the client to select their own psychiatrist. Individuals with borderline personality disorder, as mentioned before, inflict self-harm on themselves. So we want to monitor them for signs of depression and or suicidal thinking. In mental health, safety takes priority. And the safety for borderline personality disorder is the fact that they may cause harm to themselves and they may actually attempt suicide. This would be the most appropriate nursing intervention. We don't want them to be alone because when they're alone, they can self-cut or they can harm themselves. Often on an inpatient unit, there's just one psychiatrist. They can't pick a psychiatrist. Number 2, which of the following findings would you see in someone diagnosed with bulimia nervosa? So with bulimia, they're not always extremely underweight. They can actually have a normal weight. Cachexia you would see in someone with anorexia. Also lanugo. Lanugo is little fine hair that you'll often see in newborns. And when individuals with anorexia lose so much body weight, they start to grow lanugo. Because they've lost so much fat, they get an increase in lanugo, and it's the body's way of insulating that human being. Tooth enamel erosion or severe weight loss. So what finding would you see in someone diagnosed with bulimia? The most appropriate is tooth enamel erosion. I actually did have a friend that had bulimia and you could see the erosion. And the reason why this occurs is because they are vomiting, the stomach acid is so strong it erodes their teeth. So they will have tooth enamel erosion. All of the other signs would be present more in anorexia. A nurse has just started his shift. Which patient should he assess first? A new admit complaining of shortness of breath, a patient ready for discharge post an ileostomy placement, a patient that is 2 days post-op a PCI with a temp of 100.1, a post-op patient with an O2 of 96%. So prioritization, the way to tackle this question, it says, who should this person assess first? Remember that in nursing, think ABCs, airway, breathing, circulation. So we have a new admit. We don't really know what's going on with this person, and they're short of breath. Airway takes precedence. Does the fact that this person have a fever, is that concerning? Yes. However, what's more important? What is the priority? You need to figure out if someone can't breathe, they're going to die. So airway takes precedence over all the other patients. This is a normal finding. A nurse is teaching a patient about warfarin. Which patient's statement indicates further instruction is needed? I will use an electric razor to shave. I will get my labs drawn every month. I will check my skin for rashes. If I have a headache, I will take aspirin. The thing to look out for is that it says further. If you ever see that a question stem says further, you need to flip your brain and say, I have to pick the opposite of what I originally was going to pick. So if you said D, you have the right answer. The reason for this is that warfarin is an anticoagulant. And that's all of these are actually correct answers. They should be using an electric razor because less chance of cutting themselves and bleeding. They do have to get their labs drawn to check that their levels are in therapeutic range. A possible side effect of warfarin is a skin rash, so they have to monitor for that. And if I have a headache, I will take aspirin. So you don't want to take an anticoagulant and an antiplatelet because you increase the chance for bleeding. A nurse is about to begin assessing an 8-month-old infant that is sitting quietly on his mother's lap. Which assessment should the nurse conduct first? So think about this logically. Basically, a baby that is sitting on the mother's lap, where are you going to start? Are you going to do the moral reflex? Are you going to palpate the abdomen? Are you going to auscultate heart and lungs? Are you going to check the tympanic membranes? So if you said auscultate heart and lungs, you are correct. The moral reflex actually starts to disappear in infants between 2 to 6 months. And the thing you want to do first is you want to auscultate. Why? Because the child is already quiet. Once that child starts crying because you checked their ears, you're going to have a hard time calming that baby down, or the mom is going to have a hard time calming the child down, and you're not going to be able to hear the heart or the lung sounds. So the priority would be auscultation. A patient recently suffered a cerebral vascular accident. Which part of the brain was affected if there were changes to their vision? This is a pure knowledge-based question. Rarely will they be this simple, but this is making sure that you know which part of the brain is responsible for which function. And if you said C, the occipital lobe, you are correct. The occipital lobe is responsible for vision. The frontal is usually used for logic, reasoning. Temporal is for hearing. And the parietal lobe helps with sensation and perception. Number 7, which statement by a student nurse indicates further instruction is needed in regards to administering heparin? A, I will not administer near the umbilicus. B, I will check PTT before administering. I will not massage the injection site after administering. Or D, I will gently aspirate prior to injecting heparin. So correct, you do not want to administer this near the umbilicus, right? You do need to check the PTT before administering. You should not massage the injection site. Should you aspirate? This is a subcutaneous injection, so no, you should not aspirate. And in fact, new studies are coming out that are indicating you don't even really need to aspirate for an intramuscular injection. But that is not part of this question, so I'm not going to get into it. But no, you would not aspirate prior to injecting heparin. A patient with chronic renal failure is put on a low-protein diet. The rationale for this is a low-protein diet reduces the buildup of blood urea nitrogen and other waste byproducts. A low-protein diet helps increase sodium and potassium levels. A low-protein diet reduces blood pressure, and a low-protein diet increases albumin. Urea is made when protein is broken down in your body. Urea is made in the liver and passed out of your body in the urine. So if your kidneys are not able to remove urea from the blood normally, your BUN level rises. So a low-protein diet does reduce the buildup of blood urea. When individuals consume too much protein, the kidneys have to work harder to excrete urea. Urea is made when protein is broken down in your body, and it's often a result of eating protein. And urea is made in the liver and passed out of your body in the urine. So in an effort to save the kidneys and to not tax the kidneys, and I don't mean tax in regards to like taxation, I mean not tax them, not overwhelm the kidneys. A low protein diet helps increase sodium and potassium. We don't want potassium to rise. We don't want sodium to rise. So that would be incorrect, period. But a low protein diet does not increase sodium and potassium. And a low protein diet reduces blood pressure. No, actually studies have shown that a diet that is higher in protein is, especially vegan forms of protein, is associated with lower blood pressure. Number 9, a student nurse is reviewing a patient's chart. The patient's patellar reflex was charted as 3+. The student nurse knows this reflex is it hypoactive, normal, brisk, or hyperactive with clonus? So the correct answer is brisk. 4+ is very brisk, hyperactive with clonus. 3+ is brisker than average, slightly hyperreflexive. 2+ is average expected response or normal. 1+ is somewhat diminished, low normal, and 0 is no response absent. Number 10, what is an early symptom of hypocalcemia? Keyword here being early. Is it a positive Shavastic sign? 3+ deep tendon reflexes, a narrow QRS complex, numbness and or tingling of extremities. If you said D, you are correct. And early, now you can have a positive Shavastic and hypocalcemia. The keyword in this question stem was early. And the first symptoms people may have will be the numbness and or tingling, maybe of the lips, of their fingers, of their toes. Thank you so much for watching. Make sure you hit the like button, make sure you subscribe, and make sure you turn on that notification bell.